Okay, welcome to the Grapevine Wellness Show. I'm your host, Jolyn Armstrong, and we're going to start today's interview in just a minute. But first, I want to just talk a little bit about depression, because as you may know by now, depression is the leading cause of disability in the United States. That's part of the reason why I founded Grapevine Trauma Recovery and Emotional Wellness. I provide professional coaching for people who suffer from depression, anxiety, chronic stress, trauma, and PTSD. Depression, anxiety, and trauma hurt. They can strike anyone at any time, no matter their race, religion, or their background. So here's the good news, though. I can help you find peace and happiness again and get your life back. I've helped others do it, and I can help you too. Even if you've tried therapy in the past and been disappointed with the results, let's talk, okay? The research-backed methodology that I use is different from most of the traditional approaches that may not have helped you in the past. So for a free consultation, visit gvtraumarecovery.com or call my office, 916-415-8619. That's gvtraumarecovery.com, or call 916-415-8619. So that stat about depression being the leading cause of disability in the US is just one of the many reasons I'm especially excited to talk to tonight's guest, Dr. Robert Watson. Dr. Watson is a board-certified surgeon who has always had a passion for health and wellness. For the length of his career, he has studied and practiced an approach to optimal health and longevity that avoids the need for medications. That's right up my alley for sure. He believes that each individual in his care should be treated as a whole person, not just a collection of symptoms. So to that end, he prides himself, in delivering top quality medical services to men and women in the Northern Nevada area. So, Dr. Watson, thanks so much for being here tonight and agreeing to this interview.
It's my pleasure. Thank you for having me.
Yeah, definitely. So, I gave kind of the 10,000-foot low detail view of who you are, but maybe fill in the holes and let us know who you are and kind of what has brought you to this moment in your life.
Sure. Well, as you said, I've always had an interest in health and wellness. When you're gunning for medical school, they tell you you shouldn't have a plan B, but I'd imagine that most of us did. And my plan was to study optimizing athletic performance. So I always was interested in biochemistry and physiology and how the body worked. And it was always my personal goal to never have to take medications. And so I always read about, how to maintain health, again, without medications. I went into surgery. Retrospectively, I look at it probably for the wrong reasons. I got a lot of attention and credit for my abilities in surgery, and everyone kept saying, you need to be a surgeon. And so I kind of took that to heart, but I would never really thrived in surgery. I was never really found my joy. And pretty much within the first 5 to 10 years, I was looking for a way out, but I didn't know how to do that. You're trained in something, you're making a good living in it, and changing directions was very scary. And I didn't have the courage to do it until about 19 years into my career. And then I discovered, two pursuits, actually. First was functional medicine, which is getting to the root cause of disease instead of just throwing medications at it. Around the same time, the Nevada law AB 474 came down the pike, which was, the opiate law, which was going to place significant restrictions on the use of opiates. As a surgeon, I had to, repeatedly treat pain. And so I was looking at alternatives. Around the same time, a colleague of mine was looking at alternatives. He was an emergency department physician, and we both came across ketamine, and he had the bright idea of starting a ketamine clinic. I hadn't heard of him, but we both looked into it significantly and thought, there's nothing like this being provided. We knew the impact of depression on society. And so we went ahead and opened up a ketamine clinic, and it's been nothing but rewarding ever since.
Wow, that's amazing. So you and your partner, so you said, did you say 19 years into your career? Is that what you said?
Yeah, 19 years as a surgeon before I changed gears. Yeah. Since I bought my partner out. And so it's basically a solo practice at this point.
Gotcha. So how long have you been in business with the ketamine clinic?
We opened the clinic in 2017. We were the first clinic in the region by at least a couple of years.
Gotcha. Gotcha. Okay. Wow. Exciting. That's a cool, such a cool story. And you're right. The kind of courage it would take to move from, I mean, you didn't just have a 6 month little training, whatever, to be a surgeon. So yeah, that was a lot for you to move through. I can imagine.
Yeah.
Yeah. Yeah. So folks are coming to you. A lot of them, depression is motivating, I would imagine. Let's talk about depression a little bit. What is depression from a physician's point of view? And what is making that the leading cause of disability in the US?
It's a medical condition that needs to be recognized. It's multifactorial. There's not any one contributor usually. There's biopsychosocial or social elements, there's biological, genetic elements, there's psychological elements, and all of those combined contribute to depression. We know that a lot of it is biological, and that's where I enjoy focusing, is on the underlying physical reasons that people would manifest depression. It's associated with a number of physical disorders. People will often have pain or increased pain. They can have gut disorders. They can have decreased cognitive function. It's associated with Alzheimer's. We know that a significant people suffering from depression are going to go on to Alzheimer's, and whether Alzheimer's or depression is a kind of a prodrome or something that is in the natural sequence of Alzheimer's or a cause, that's being looked at.
Yeah. Terrifying. That's a scary thought for sure. Wow. So let's talk about some of the common treatments. I know we're going to get to what you do specifically, but what are some of the most common treatments for depression that people can seek out?
Sure. Well, of course, the ones that most people are familiar with is or would be the pharmaceuticals. Serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, this tricyclic, and then there's some other pharmaceuticals that are considered atypical. There is, of course, talk therapy, behavioral cognitive therapy, which in some studies or several studies has been shown to be as efficacious or more efficacious than pharmaceuticals, and in fact more enduring, meaning years down the road people still have those tools and can apply them, whereas oftentimes pharmaceuticals lose their effectiveness. And I also point out that though it's very controversial, there's a lot of work that says that, and this upsets a lot of people, but the truth is that pharmaceuticals, for a lot of people, for the greatest majority of the population, don't work any better than placebo. But placebo, I'll point out, is incredibly powerful itself.
No, I get that. And they come with some pretty drastic side effects as well that need to be dealt with when you're taking those pharmaceuticals too.
Sure. Sexual dysfunction, sometimes permanent sexual dysfunction. Weight gain is a big one. Flattening of the affect, where people no longer feel joy. They don't feel the range or the breadth of emotion. Those are the ones I hear about most commonly. I would say at least a third of the population that comes to me for ketamine therapy is seeking to get off of those medications. So they have a role. A lot of my clients have said that they do help, that they have helped them, but a lot of the clients are also looking to get off of them permanently.
Yeah, boy, I can imagine that for sure. So you use ketamine to treat your patients who suffer not just from depression, trauma, and other things as well. Let's talk about ketamine itself. What is it? Maybe give us some history.
Sure. Ketamine was invented as a general anesthetic. It's a derivative of another drug that was found to have some good anesthesia properties, but it also has some lousy anesthesia properties. We like drugs that are good for pain control, that don't allow people to remember the event but they can't be long lasting. When the surgery's over, the anesthesiologist wants to be able to turn off the medication and have the patient wake up. So they went into the lab and they tweaked the molecule until they came up with ketamine in 1962. By 1970, it was approved. And one of the things I'll address, because ketamine is certainly more of the population is aware of the use of ketamine for depression now, but there's still a stigma attached to it. The things that you'll tend to hear is it's being used off-label for depression, or for anxiety or PTSD, and that's true. But that doesn't mean that it's not entirely appropriate. When a company submits a drug to the FDA for approval, it's not just that drug that's submitted, but the drug with a given application. In this case, ketamine was submitted as a general anesthetic. That was its approved on-label use. Now, as is the case with many medications, we often find that that same drug is useful for other applications. In this case, depression was found to be remarkably effective for depression and anxiety and PTSD. But unless the drug company wants to go back and submit to the time and expense of getting approval for a second drug, then we just use that off-label. It's widely practiced, totally legal and legitimate. It's just a difference in its label. People have heard that it's a party drug, and it is. Any drug that alters your sensorium, that alters the way you feel, has a reasonably good chance of finding its way into abuse circles, especially, of course, if that alteration is positive or enjoyable. And the ketamine experience can be positive and enjoyable, which from my perspective, I mean, if you have to undergo a medical therapy to get better, it's better that it be, not painful or miserable,
Yes, I vote for that. Yes.
What else? People will hear that it's a horse tranquilizer or an animal tranquilizer. But if you understand that most drugs are invented for human physiology and that humans and animals share physiology, it should be no surprise that the drugs invented for humans find their way into veterinary circles. So those are the three things that you tend to hear most commonly about ketamine. It's a remarkably safe drug. Unlike most of those that you hear advertised on television today, where 20, 30 seconds of happy, smiley people, and then the other half of the commercial out, it's going to maim or kill you. And
Right,
I'm being
right.
extreme, but ketamine was safe enough that during the Vietnam War, they called it the buddy drug. And they called it the buddy drug because they could give it to the average GI Joe, not the medics who normally dispense medications, but to the soldiers. And they told them, if your buddy gets hurt badly enough, give them this injection of ketamine to provide that psychological relief and pain relief until the medics could get there, scoop them up and get them to definitive care. We can't do that with other medications. Opiates, benzos, barbiturates, they all require medics to dispense those medications. So that says a lot about the safety of ketamine. As I said, we are the first clinic in the region. We've conducted several thousand ketamine infusions. We've never had so much as a medical hiccup in the clinic, just nothing.
Wow.
Yeah.
Oh, that's amazing. That's really good to hear. Okay. So I have some maybe curiosity about what it's like, right? When you're treating depression, one, how does it help depression? But also, what is it like for the person taking it? Is it,
Sure.
yeah.
So ketamine acts differently than other medications. It certainly acts on receptors and changes in enzyme levels and neurotransmitters levels, et cetera, while it's on board. But the treatment is a 40-minute infusion, 40 minutes. And within 12 to 15 hours, that drug's metabolized. It's out of your system. The real strength of ketamine is that it changes your brain. It induces at least two processes. One is called neuroplasticity, which is the growth of nerves and rewiring of brain circuits. The second is synaptogenesis. Synapses are the talking points between nerves, where one nerve spits out a neurotransmitter and the other nerve receives that neurotransmitter and conducts the impulse downward. New synapses are formed by, as a consequence of ketamine. And then lastly, we know that it tames inflammatory mediators, or those chemicals that are released in the body as a consequence of inflammation, which has widespread negative impact on the physiology or functioning of the body.
Yeah. Wow. Okay. So that rewiring of the brain, let's talk about that as a specifically depression or trauma treatment, what am I experiencing going into a treatment versus coming out of it as far as mindset and I guess symptomology?
Sure. What we call set and setting are incredibly important
Mm.
for ketamine therapy. We spend a good amount of time preparing the patient to know what they're going to expect. Ketamine is known as a dissociative anesthetic, which means that it alters the way you think, the way you perceive your environment. And so to facilitate that and to derive, to maximize efficacy or the effectiveness of the treatment, we prepare them and tell them exactly what to expect and then how to conduct themselves as they sit through the infusion. So we tell them, we want them in a relaxed parasympathetic state. And parasympathetic is simply a term that distinguishes what we call our autonomic nervous system. We have the part of our nervous system that we control. If I want to move my hand or bat my eyes, I can do that. But the autonomic system controls heart rate and blood pressure and such. They are sympathetic, which is the activated fight or flight state. If someone jumps out at you with a knife, or your boss is down your throat, or you almost get hit by a car, that's a sympathetic state. Basically, all systems in your body shut down except for those meant to preserve your life at that moment, to save your life. We don't heal in a sympathetic state. Parasympathetic, in contrast, is rest, digest, sex, sleep, and heal. You heal in a parasympathetic state. So we really coach our clients in the way to really get into a parasympathetic state before the infusion starts. And then after the infusion starts, we basically tell them how to navigate the experience. So the dissociative state is explained differently by everybody, but for the most part, you become a very active mind and you kind of lose touch with your body. And if you realize that it's a general anesthetic, that shouldn't be too surprising.
Right.
But we also make sure that they understand that they have control throughout the experience. If at any time they want to open their eyes and what we call ground or check in with reality, they can do that.
Mm.
So and again, it tends to be a pleasant experience. Some people don't enjoy the experience, but it's perfectly tolerable. And it's very rare that we get somebody that just does not like the dissociative experience. But even the small handful of those that do keep coming back because they see how effective the treatment is.
Gotcha. Okay. So when you're describing a dissociative experience, it's not psychedelic, or
It's
is
not true psychedelic, but if you talk to people about or if you read about psychedelic experiences and you read about ketamine experiences, you'd be often hard pressed to know what somebody was talking about. So for the most part, you could say it's like a psychedelic experience.
okay.
And
But you describe it more as dissociative. I think I can see that difference there. So when ketamine is used in surgery, is it a higher dose that's given than what you give? Is it given in a different way, or what does that look like?
that's exactly right. Yeah, we both use what we call racemic ketamine. Most molecules in nature have what we call a chirality. If you look at a pair of gloves, you'd say they're both the same glove, when in fact, one only fits the right hand, one only fits the left hand, and molecules in nature are the same way. Anesthesiologists use racemic ketamine. We use racemic ketamine. They administer it intravenously. So do we. The difference is, as you indicated, the dose. They use much higher doses than we do. We use very small doses. And again, it's only for a 40-minute infusion. And we only infuse 2 times a week. We want a period of time in between those infusions.
Gotcha. Okay. So that makes complete sense. So that tells me maybe a little bit why the buddy drug, the soldiers could be given probably a small dose, enough to take like the edge off, kind of a thing.
Right, right.
Was that how it was? Okay, that makes sense. They weren't putting their buddies completely out in the in the field out there.
I never saw the literature on how much they provided, but I would imagine it's a relatively low dose.
Yeah.
You don't want them incapacitated in the field
Right.
necessarily.
Yeah, that makes sense. Okay, all right. So let's I want to talk about and you probably have other things that you want to share that I'm not even thinking of, but if I'm a person coming in to just find out about ketamine and its treatment, or start treatment with you, what does that process look like? What does a typical kind of route look like for a person that's coming for some relief, maybe to get off medication?
I would say at the most beginning level, periodically, usually every month or couple months, we have an event that we host in our office called Ketamine Curious. And it's an opportunity for people, family, anybody to come in off the street and basically hear a discussion about ketamine. And it wasn't my idea. One of our clients, who was a victim of the mass shooting in Las Vegas about 6 years ago. She was at the Jason Aldean concert. She was pinned down for a couple of hours, and this is on a former history of traumas. This PTSD event left her essentially crippled, and it really compromised her functioning. And after her outcome, she essentially rid herself of the PTSD. And she's got a huge heart, and she just wanted to spread the word. And so she had the idea of bringing in people so she could disseminate this information. She conducts the meeting, and I'm just in the wings in case people have questions. So that might be a good starting point. Most people, however, just call up and they ask for a consultation where I sit with them between 30 and 45 minutes discussing what ketamine is, how it works, and again, how to get the very most out of the experience.
Gotcha. Okay. And then you said you infuse a couple times a week,
Right.
allowing space between. How
Yes,
does
we
that?
start
Yeah.
with 5 infusions. It's called an induction series. I would say most clinics start with a series of 6 infusions. What I've learned over the years is that over 60% of my population does great with 5. So we start with 5. That 6th one may benefit the clinic. It may not benefit the client. So we start with 5 with the understanding that around 5, we're going to be checking in with the client and finding out from them if they feel like they're in a good place where they want to be, or if they feel like additional infusions are necessary. They're really the only person that can make that decision. So we leave that up to them. So again, we start with 5 infusions, and then the other 30+% of our population may choose to undergo a 6th or a 7th or an 8th. And again, they're 2 times a week without gaps, preferably.
Gotcha. Okay. Wow. That seems like a, a, a quick path to relief for this. That seems pretty amazing.
Yeah, I would
Yeah.
say it's pretty amazing, which is why I stuck with it. When my partner wanted to close the clinic, I was having none of it. This is the most rewarding work I've done in my career. To take
Mm,
people that have struggled with something as impactful as depression, the number one cause of disability across the world, and we
yeah.
can turn them around in 2.5 to 3 weeks. There's
Amazing.
few things in medicine that are that, impressive, that remarkable.
Yeah. Yeah. So I know a little bit about living with depression, one from my work and clients, but my husband has pretty severe treatment resistant depression. You've met him once or twice, and I see how debilitating it can be. There's a reason why this depression is the leading cause of disability in the US. I would probably pick almost anything if I had a choice, almost anything else to suffer with than depression. It is unbelievably debilitating. And so a path to relief that is what, a couple of weeks of infusions with you. Oh my gosh.
Right.
Yeah.
Now, I'll point out that after the induction series, a form of maintenance is necessary. Unfortunately, ketamine is a treatment, it's not a cure. But I would say on average, patients stick with us on the maintenance phase of the program on average for about a year and a half. After that, they feel like, what I believe is happening is they've spent enough time, with a positive mindset, interacting with others, with their environment in a more positive, favorable light. That repetition influences neuroplasticity. And eventually they get to the point where they don't feel like they need ketamine anymore. They go off, and it's very unusual for a patient to come back and need to initiate treatment again.
Amazing. That's amazing. Yeah. Yeah. So you told us about the client that you had that was at that concert that was so traumatizing for so many people, do you have some other stories that you can tell without breaking confidentiality? Some some results.
Oh gosh. Yeah. Where do I start? Uh, the first one that pops into mind isn't a depression story, but depression and anxiety often go together. This
Mhm.
was an anxiety young woman um, who was crippled enough by her anxiety that she could not work and she couldn't leave home. And we treated her. And at the time, I was still working as a surgeon, and I was walking through the halls at St. Mary's, and I heard my name called, and I stopped to turn around, and it was this young woman's mother approaching me. And she said, "Dr. Watson, I just wanted to tell you that so and so, her daughter, has
Mhm.
responded so well that she has moved out of the house and she had a job interview that week." Okay, so that's an anxiety story, a PTSD story, the one I told you. I can think of
Mhm.
another gentleman who had done 6 tours in the Middle East during the conflict over there. Severely traumatized, disabled. His marriage was on the cusp of dissolving, and his wife basically brought him to the clinic and said, "You need to do this therapy. I love you, but I can't do this anymore." And so he underwent treatment, and again, great results. And again, saved his marriage, and he is now, actively employed and loving life. So
Amazing.
that's a PTSD story. Depression story, same thing. At home, won't even get out of bed to open the blinds or cook for herself in the microwave, and treated. And within a few weeks, was writing a book about her experience, and employed, moved out of the house. The whole, this story is we've seen several times.
Yeah. Yeah. It's just when you think about what life, we hear stories, but when you really think about what life would be like, not being able to get out of bed, holy cow,
Right.
that's something. And then to go through this treatment and I'm employed, not only am I out of bed, I've got a job now. Like,
Right.
it's a big deal.
Yeah,
Yeah.
because ketamine affects motivation. You just lose drive. You want to withdraw. You don't want to engage with others.
You mean
Um,
depression? You said ketamine, but depression.
I'm sorry,
Oh, sorry. Yeah, no, it's okay.
depression. Yes, yes,
Yeah.
yes. Uh,
Yeah.
Very impactful.
Mm-hmm. Mm-hmm. Wow. Okay, so I've seen a couple of questions come in. I want to make sure that we have said what we need to say. Is there anything I haven't asked you specifically about ketamine that you want to include about?
Hmm. Um, No, I could talk about ketamine all day, but nothing particular. I think the important things are for the people to understand that it was remarkably effective. In contrast to SSRIs, which again I said, are ineffective, no better than placebo for the majority of the population. In those studies that show efficacy, it's a statistical significance and not usually a clinical significance. Um, Ketamine, in contrast, in our clinic, I quote, the people come in at a 92% success rate. And I make the point that that is determined by them. So when they come in, we do the typical screening tests to gauge the severity of their depression. We also conduct that same test upon completion of their ketamine induction series. But
Mhm.
patients, clients, people don't care about scores. They care about, do I feel better? Did this
Yeah.
work? Was it worth it? And if the answer to those questions is yes, then we put them in the success column. And over 92% of the clients coming through here go in the success column as determined by them. Now, I also point out that we don't just administer the ketamine. As I said, we spend a lot of time prepping them so that they know how to get the very most out of the experience. And I also talk to them about the lifestyle factors that contribute to depression or anxiety, to the mood disorders. We can't forget that the mind and body are connected. They are not separate. And if the body is unhealthy, the mind is going to be unhealthy. And I really look at the mind as kind of like the canary in the coal mine. It's going to be one of the first manifestations of disease many times.
Mm-hmm. Mm-hmm. Oh, yeah. All good things. All good things. Yeah. Okay, so I'm going to take a look at our questions coming in. Why don't you tell us again? You talked about the ketamine curious clinics. I love that name. Tell us how often you run those, where your office is. Tell us a little bit about your practice and how we can get in touch with you. Um,
Sure.
yeah.
The clinic is Well-Centric Health. We're in Reno, just east of the intersection of Lakeside and South McCarran.
Okay.
Um, to call to get an appointment, to ask for a consultation, just call the office, speak with Tina or Kyla. The number is 775-335-2044. And all you have to do is tell them that you're interested in ketamine. Kyla and Tina are both excellent at answering questions and help you decide whether or not it may be right for you and if a consultation is appropriate. For the Ketamine Curious events, we have one coming up, and I want to say the 22nd, but don't hold me to that. Again, if you call the office, Kyla will be able to tell you when the next Ketamine Curious event is.
Beautiful. Okay. Do we have to be Reno or Nevada residents to work with you?
Let's see. During COVID, there were some laws regarding telehealth. Um, I believe as long as you're in Nevada, then I'm legally allowed to administer. I can't cross borders. I can't administer, but of course it's an infusion, so that wouldn't be possible anyway. So, well, the answer is yes, we can treat. In fact, we've had a lot of people from California come
Okay.
across the border, and we've had people from Wyoming, North Carolina, uh, pretty much a lot of states come to us.
Gotcha. People travel for your infusions. They're in your office, and that's completely doable. Okay, cool. Good to know. Jane, hi Jane. Jane says, is it a temporary fix or long term? I think we talked a little bit about this. And how often does someone need the treatment? I think we talked about this. It might be worth it because you talked about it a little bit earlier. Just reiterate quickly for that one.
Yeah, absolutely. So we begin with the induction series, which
Yeah.
at a minimum is 5 infusions spread over 2.5 weeks. Excuse me. Um, some people need a 6th or a 7th. It's determined by them. Then we switch into a maintenance phase. Booster infusions are always going to be necessary. Sadly, people will peak their mood and it'll sustain them for a good while, but eventually they're going to start to lose that effect. And when ideally before they lose the effect, but around the time if they notice that they're starting to backslide, that's the time for what we call a booster infusion. So they simply come in, get another infusion, and then go home. We have two modes of maintenance therapy. One is to come in for periodic boosters. On average, I'd say people come in about every month to 6 weeks for those. We also, if the client is appropriate for such, then I'll also provide the ketamine in a troche form, which is a dissolvable tablet that they tuck under their tongue. They try to recreate the environment that we've created here at home. And then they take the ketamine by themselves in the evening when they no longer have to be productive, make decisions, drive, etc. And of course, the dose is much milder. It wouldn't be appropriate for home. But they take that on the same schedule twice a week. And what that does is put more time between the need for boosters. So instead of needing to come in, say, every 5 weeks, maybe they can stretch that out to every 8 or 10 or 12. It just depends on the physiology, the uniqueness of that individual.
Gotcha. Okay. All right. Good to know that. Any side effects?
There, as far as long term, there are not. During the infusion, it has a mild sympathetic response, so it'll increase blood pressure a little bit, but really no more than if you were carrying a heavy box in from the garage. And once the infusion is over, your blood pressure comes right back down. It's not a worrisome elevation. For those people that come in with unacceptably high blood pressure, we have medications to bring that down to keep them in, perfectly safe range.
Oh, great. Great.
Um,
Okay.
and of course, there's the dissociation. If you read about the use of ketamine, a lot of practitioners will call the dissociation a side effect. I view it differently. There are really two sides to the ketamine. There's the physiology, where we can talk about glutamate and mTOR, AMPA receptors, NMDA receptors, brain-derived neurotrophic factor, et cetera. We understand a lot. There's a lot we don't understand, but the physiology part we're getting a handle on.
Mm.
What we don't understand is the more ineffable, the more, the psychedelic, how that really works to rewire the brain. And a lot of the experiences that you read from people that have had psychedelic experiences, meaning very profound, life-changing events, that's the other side. And so it's my view that if we can provide treatment for PTSD, anxiety, depression, OCD, whatever it may be, but also potentially provide them this other enlightening experience, then I want to do that, and most
Right.
patients want that. So I don't look at the dissociation as a side effect. I look at it as an added benefit of the therapy.
Mhm.
As far as afterwards, there really are no side effects. You're not left with, concerns of cognitive deterioration or, flattened mood, weight gain, sexual dysfunction, none of that.
Gotcha. Oh, wow. That is, yeah, that's that's good to know. Um, let me I had a question in my own head and then it just escaped. So I'm going to ask another question from our list. We've got a couple more. Um, Zandra, hi Zandra. Zandra says, is it addictive?
It is not addictive.
Okay.
When you read about ketamine, some people will raise the concern about addiction because it's a party drug. Some people will like the experience so much that they will seek it out and reuse it. So there is a potential psychological addictive component, but it's no more. It has no physiologic addiction like heroin or tobacco or alcohol or even caffeine for that matter. It has no physiologic addictive component. And when we're using such low doses and so infrequently, we just don't see that element at all.
That's beautiful. Good. Okay. So I think I was thinking when you were talking about dissociation being listed as a side effect, it almost seems to me like that's part of the healing, right? Not even it is part of the experience, right? I don't
It is
know.
absolutely part of
It's
the
like, yeah.
experience. I can think of a client who came in estranged from her daughter. A lot of her distress, a lot of her depression revolved around her family issues, and as a part of that dissociation, she had this third party perspective. And that's one of the things. It offers a third person view of the way you lead your life, the way you interact with life and others, a perspective that you wouldn't have had the advantage of having,
Yeah.
otherwise. And so she was able to she had a revelation during one of her infusions. She called her daughter, who is in Florida, and now they have a beautiful relationship and sail together.
Oh, that's amazing. Oh, that's really good. Okay. All right. So we have one more question that's going to lead to a couple of practical questions. And this is about payments. Does insurance cover this? What is the cost associated? Give us an idea of that.
Sure. Sadly, it's not covered by insurance. You can find coverage for pain, but that's an entirely different program.
Mm.
Um, Sadly, the insurance companies have no interest in. I mean, I don't know why. It seems they would really want to jump on this because it's said and done. I mean, we get people off ketamine, as I said, on average after a year and a half, and that eliminates the concerns for disability and lifelong medications and side effects, etc. So it's not covered by insurance. The cost, I don't know exactly. You'll have to speak with Kyla. I tend to stay out of the money side of things and focus on the medicine, but it's around $450 an infusion. So it's not a cheap therapy. But when you consider how efficacious it is, most patients only kick themselves for waiting. We've had patients call for up to 2 years, basically window shopping, and they just can't muster the initiative to take the leap.
Yeah.
But once they do, they consistently say, "Oh my gosh, this was transformative. I wish I'd done this 2 years ago."
Yeah. Well, I would argue that at that price point, depression is an incredibly expensive disability to have,
Yeah,
and so yeah, that's wow. You're offering just such an amazing service to the community. So I appreciate that.
and that's
Um,
why it's the most rewarding work I've done.
yeah, right. Oh, so cool. All right. So we have come to the end of the list of our questions. And I'm going to leave those open a little bit. So if anyone else thinks of something that they want to ask in the next couple of minutes, we'll grab that. I'm going to talk a little bit about some aftercare and support services that are available and possible with your practice in particular, if that's okay with you.
Of course.
Yeah, because that emotional care between sessions and after treatment, to address those underlying issues that cause people to come to seek help in the first place is pretty important, and increases the efficacy of it and the length of healing. Do you agree?
Yeah, absolutely. In fact, it's worth touching on that there is something called ketamine assisted psychotherapy, where we engage with practitioners who have been specially trained to counsel patients or engage in talk therapy after a ketamine session. Usually what I've learned from those therapists is that the day of is not the best, but the day following is the best time to explore their experience and help integrate those revelations or those experiences into their everyday life. And so we do have those practitioners that we work with, to include yourself.
Yes, thank you. Yeah. So, yep, I provide the emotional wellness coaching throughout the course of treatment. After treatment has been completed, this does help ensure that your patients get maximum benefit, since like a really sustained mental well-being from this really increases that effects of well-being for a longer period of time, maybe extends a period between the boosters that are needed as well. So anyone on this, watching this on this call, listening to this in podcast form, if you're currently in ketamine therapy or you're considering it, and you are interested in support through your journey, you can call me. We've put Dr. Watson's information in chat, and I'll also link it everywhere that anyone's going to watch this in the future, listen to this in the future. So you can get a hold of both of our practices. Dr. Watson, I really appreciate your time here and letting us pick your brain for so long. Thank you so much.
It's been my pleasure. And I'd like to thank you for what you do and your help to the clientele, to the people struggling with PTSD. I mean, we've talked mostly about depression, but PTSD can be just as negatively impactful.
Yeah, it's a big deal. It's a big deal. And it hits people out of the blue very often. So trauma is a big deal. Yeah, I appreciate you, Dr. Watson. And until next time.
Thank you.
All right, then. Bye-bye.
Bye-bye.